Hey everybody, thanks for joining me today. Dr. Ross Marcagiani with Turnpaugh Health and Wellness Center and another great word of the week. Today's word of the week is going to be mold toxicity. We're going to talk about how does someone get mold toxicity, how does it affect your body, and how to test and remove mold. Let's dive in. So mold toxicity, a lot of patients are aware of what mold is. It typically, your most common molds are going to be coming in four main forms. You're going to have your aspergillus, you will have your stachyboitres, you will have your penicilliums, and you will have your fusarium. Those are the most common mold spores or mold toxins that we're exposed to. But I want patients to be aware of that mold toxicity is not just from water damage from the home, right? And with a lot of my patients that do have mold toxicity, a lot of them are, well, I don't smell mold or see mold in the home. I hear that quite a bit. And just because you don't see nor have that musty smell in your home doesn't mean you're not having mold exposure. We want to be aware of it. If you have a dirt basement, that's a really high breeding ground for mold and mold spores or mycotoxins, which we'll talk about in just a moment. Also, if you're noticing just in general, the home is damp, right? It's the summertime right now, so I want to make sure, humidity is up, heat is obviously up, so the breeding ground for spores and mold to propagate is at its peak right now. We want to make sure being aware of contaminated food and contaminated water. This can cause or increase mold toxicity. And if we have poor ventilation, in this area we live in Lancaster County, which is a lot of farms. So there's a lot of heavy farming equipment, a lot of dust, pollen, and farm debris that is thrown into the air. With that being mold spores or mycotoxins being thrown into the air. So if we're living in a high farming area and having poor ventilation in the home, that could be another common exposure. Now, what would be some common symptoms? More common: extreme fatigue, joint pain, severe brain fog, sleep disturbances, GI issues, prolonged illness or compromised immune function. If you're noticing chronic sinus congestion, chronic sinus infection, that's another common sign here. What would be some testing that we could do? So the first thing would be making sure any areas that you think that are even susceptible, getting an at-home test. The one that I prefer is Mycometrics. You can see the URL here. Either the ERMI or the HurtsMe test are both really, really highly valid tests when testing mold exposure in the home. They are at-home tests, and depending on your physiological markers here, they will want to see an ERMI of less than 2 or HurtsMe of less than 10 is typically gold standard. Also, we can test for mycotoxins. So these are basically, think of these as little children that the mold spores actually spew out. But they're just really small spores that are produced by the mold, that are produced by the aspergillus, by the fusarium, by the stachyboitres, by the penicilliums. So just be aware of that. And this does a really good job of assessing the mycotoxins that are produced by these molds. I usually use Great Plains Laboratory, which is a really good test. We can also run some blood markers here, your melanocyte stimulating hormone, your vasointestinal polypeptide, your antidiuretic hormone, your VEGF is another marker, your TGF-beta, your complement C4A, your metallomatrix protein 9. These are all markers that we can use for blood to assess the exposure of mold as well. So how do we remove mold? So first, if you have mold, if testing comes back with an ERMI or a HurtsMe test elevated, we want to make sure anything that collects dander or traps particles, we want to remove those. So like rugs, teddy bears, blankets, pillowcases, pillows, things that just tend to have a lot of particles sit on for a long period of time. We want to make sure we either, depending on the severity of it, either get rid of furniture or thoroughly clean furniture. There's a lot of there's a lot of back and forth on that in the mold community, if it should be thrown out. Also with the moving of homes, that's a whole nother discussion that would need to be had on a separate video. If there's any suspect or you see mold, you can do 1 part Clorox or 3 parts water. Make sure when you spray, you leave the house for 3 to 4 hours while it's off gassing. That can be very noxious to the patient or to whoever is trying to kill the mold. Must do a paleo diet and be grain-free. Additionally, no strawberries, oranges, grapes, apples, raspberries, no cauliflower, no tomatoes, no bell peppers. These are the most commonly mold-laden foods. I would probably also add no peanut butter. They're really, really common to have mold spores. I would recommend, depending on the severity, at least a 3-month adherence to this. And then we could try some therapeutics like cholestyramine. This is a medication. Cholestyramine, Welchol, they get used interchangeably. You just want to be careful because you can create severe constipation with this. And any binders need to be taken on an empty stomach. I typically recommend at least an hour away from food on either end. Here are some other binders that we could use, are more natural: OptiFiber, Toxin Pole. These are things that have like diatomaceous earth, bentonite clay, and other binders that help to bind those mold spores. You can also use DIM, diindolylmethane. You can use calcium D-glucarate. These are really good therapeutics here. Want to make sure you have a good water purification system, whether you're using an osmosis. That's what I would typically, a reverse osmosis is what I would typically recommend. And then getting some type of air filtration unit or whole system air filtration unit. Austin Air is a really good portable system. My brother uses it. I use it. It makes the house really have good air quality. I hope this video was helpful. If you know anyone that can share this video, please don't hesitate to reach out to them. And if you're suspecting mold toxicity, mold exposure, please don't hesitate to reach out to our office. Thank you and have a wonderful day.